got brains to match the quote. The mother of the Hoodwives, I'll fist the fold. Tell me what your thought juice is, cause I bring the bottles and the truth is I'ma lay it out for all the fools here. I make it clear, 100 proof, period, ayy. Princess E money, time to cash out. I'm commando for the shorties, park clips out. Do a little dance, shake a little ass. I'm just tryna ask, what's your thought juice?
Girl, bye.
Dun-dun-dun.
Marrying a black doctor. Wait, what? Beautiful. Okay, and the mic. What is up, everybody? It's your girl / boy. Yes, I gotta do it. What is up, everybody? It's your girl / boy, E'mon Lauren, the Red Light Polo, BlkHoneyBun's bitch, and you already know what we here for, the realest show with the hottest stories, the real Hoodwives Chicago, a real show with hot sauce stories. Yes.
All of the above.
Yes, I'm E'mon Lauren, your host, and can we please give a warm welcome to Brittany, Dr. Brittany.
Yeah, we'll just say Dr. Brittany. Hello, everyone. Nice to meet you all.
Before we start, we want to give a very special thank you to the Let Us Breathe for the Let Us Breathe Collective for courtesy of the space at the Breathing Room. And this production was brought to you by BlkHoneyBun Productions in association with Rise Above and Prosper. Hi, Carlo. Yes. Brittany!
Hello, E'mon. E'mon.
My Scorpio sister.
My Scorpio sister. I'm well. How about yourself?
I'm considering.
For sure.
Considering I'm blessed, you know, the Scorpio moon. How the Scorpio moon treated you?
Overall, okay. Like, I would say, I was talking to my therapist about this the other day. I feel very content in the season that I'm in right now. Mm-hmm. So I feel like all of the blessings that I'm getting, I feel like I'm trying to reciprocate that out to the other people that are in my life. So
yes.
I'm content.
Literally.
With where I'm at.
Literally. I was literally saying that. I was honestly kind of flexing. I was walking around like, yeah. Moon been real good to me.
Yeah, I know, that's right.
Y'all going through it, but then this weekend happened. I was
like,
fuck.
It happens.
I thought I was going to get out unscathed, but I didn't.
It's a balance.
Dr. Sister Brittany. Y'all, I know fucking black doctors. Like, this is why this show is the best show. I know fucking black doctors that be birthing black babies, and that shit is incredible. We were talking about it over the weekend at your house with your mom, and it just really got me inspired to ask all the questions. So why don't you introduce yourself and tell us?
So my name is Brittany.
Yes.
As you guys know, most people actually I have my patients call me Dr. Britt because I
Dr.
feel like
Britt.
because I feel like it builds a little bit of camaraderie between me and the patients. But anyways, I work as an obstetrician and gynecologist in Chicago, and
So you fist professionally.
well, not exactly like that, but for the most part, depending on the situation, we will need to do exams on patients quite often. So part of my job is like removing uteri or doing a hysterectomy. And then the other part of my job is delivering babies.
Wait, delivering, I mean, like removing uteri?
Yeah, your uterus, girl. Some people don't want it anymore. I know.
I mean, I'm not trying to judge, but
I know.
I mean, like, is that like a tube tie, a burning? My OG had her tubes burned.
Yeah, it just depends on the situation. So it's a little bit different. So when you remove your tubes, that's like you're getting like a sterilization procedure done. But when you get your uterus removed, that means you're getting it removed for whatever reason. So maybe fibroids. It may be that you're having abnormal bleeding related to cancer. So there's a bunch of different reasons that people would want to remove their uterus.
Does that also go in the line of like gender affirming care?
It can. It definitely can. Actually, the hospital I'm at has gotten way better at the kind of care they provide for LGBTQ or those that are transitioning male to female, female to male. And what's really dope is that the surgeries that I am a part of have to do with removing the uterus and then going into another surgery, to kind of replace the parts of innie to outie, outie to innie, that sort of thing.
That's actually fire as hell.
Yeah, I'm trying to like explain it in layman's terms. So it's a very long case. It can be a lot of teams are involved, plastic surgery and urogynecology. So many people are involved, but all in efforts to get the patient their desired look.
Oh my goodness.
Yeah.
I have so many questions for you and I'm really excited. But before I forget, this is a segment called What's Your Thought Juice? Hold on. Yes. All right. What's happening, folks? I'm Black the bartender, and welcome to the Pink Polo where we juice your thoughts. What do you have?
Huh? What? Alright, sure. First you want to get you a nice glass, preferably one with some nice merchandise on it that you can get at your local bartender, alright? Alright, next you want to get you some nice dry gin, whichever you prefer, preferably the one that reminds you of your mother, alright? Give it a nice steady pour and crack her open. Right? Alright, next you want to get you some tonic water. I personally like the one with elderflower because it's a little special, but get whatever you like, right? There you go. Give it a nice steady pour. Serve it up on a coaster. Serve it up neat. And there you have it. And it'll be gin and tonic, or in other words, Dr. Britt's thought juice. I'm alright. That may actually make me have a baby. I'm actually good on that one.
We got it now. What is your thought juice, Dr. Britt?
So I always keep it classy, never trashy, and I always go for a gin and tonic.
Yes!
It's my drink of choice.
Would you like it?
Yes, I would like a little sip.
Yes.
Thank you.
Of course. And make sure that you get all of your thought juice needs at hoodwivesorshy@gmail.com because the website is coming. But you too can juice your thoughts here at the Peak Polo Lounge, where Black works at, because Black isn't here right now. It's a bartender, and he be juicing thoughts, and like
Sure.
he's like this drunk bartender, but he makes like the best drinks ever.
Wow.
Like he always has to drink them before he serves them to
Yeah.
you. But like that's just to make sure that they're like good.
It's up to a caliber.
Yes.
I love it.
So he made you a good gin and tonic today.
I love it. It tastes delicious.
Great. Why is gin and tonic your thought juice? It is very classy. It's very waspy.
It is. It is. I think the reason why I like it is that I feel like I can have a couple cocktails of gin and tonic and still be able to maintain my element. I don't like when I drink and I'm acting outside of myself.
Oh,
Girl. So
it's about to be a what? A girl fuck you.
Girl. So I try to stick with the gin and tonic because I think it still keeps me pretty leveled, but also gives me that like kind of buzz to be able to partake in whatever festivities I'm partaking in.
I love that.
Yeah.
My mom used to drink Tanqueray on the rocks all the time, but I've really grown to love gin. Like I've really grown to love gin. It's a good refreshing drink.
I agree.
You know, speaking of alcohol, a lot of decisions get made off of alcohol that shouldn't be made off of alcohol, right? How many pregnancies would you say occur or happen like based off of like a good drunk night?
Oh man, I don't know if I can even equate or give you a percentage on what, because what happens behind closed doors has nothing to do with me. I just will see them on the other end of it. And some patients will allude to the fact that we always ask patients, is this pregnancy planned?
Right.
And then we always ask if the pregnancy is desired.
Right.
So
'cause situations definitely be happening.
And that's when some of those stories will come through with, you know, this night or whatever, this happened. So what I will say is that there are some pregnancies that happen to be unplanned, but it kind of, you know, diverges with what they want to do in terms of having a desired versus an undesired pregnancy.
Now, I know that you're a real doctor, so you're going to keep it very professional, right?
100%.
But I got to ask the real questions, right?
Love it.
Okay, so like I thought I was pregnant most recently because my period was really, really late. So I decided to wake up in the morning and take 3 shots of Hennessy. Could that have like, is that like no?
Yeah, that has nothing to do with anything. I'm just blessed. You just got drunk on a Tuesday.
Okay.
Yeah.
And then it wasn't pregnant.
It wasn't pregnant.
Okay.
That's
That's
good.
a fact.
That's good.
What about epidural? Like, I know that you can't drink during pregnancies.
Yeah.
They sometimes say that like a cup of wine is okay. Like, is that?
No amount of alcohol is, or any amount of alcohol is unsafe in pregnancy. So that's what the data shows, because there are so many things that can go wrong with baby if the mom is drinking during pregnancy. So
my mother drank with me.
So I'm not saying like every single mom who drinks.
Don't drink. Don't drink it get pregnant, guys.
No, don't drink it pregnant.
I'm just saying I'm just naturally perfect, so it only makes sense that I came out right. But don't drink it pregnant.
Don't drink it pregnancy. It's not a good look.
Oh shit! I forgot what the fuck I was gonna ask you, but it was about epidural and pain like that. I know that you also, what you're really passionate about is really delivering the message of the medical history of Black and brown bodies, especially birthing Black and brown bodies 100%. And indigenous work. Can you tell me a little bit about like the inspiration of that work and like how that reflects to your personal mission of you being a doctor, even though I understand that like it's guidelines and thing that you 100%. Have to, but like, you know, maybe that extra care that comes into your mind with your own facilitation.
Absolutely. Well, historically speaking, Black and brown bodies, Black and brown women, we're always experimented on. Even as slaves, they were not given medication that could help with the pain that they experienced during this experimentation, even though there was pain medication available during that time period. And Black bodies have been experimented on depending on, you know, you're familiar with like the Tuskegee trial, and then obviously with like examining how women tear when they have vaginal deliveries, and like fistulas and things like that. A fistula is an abnormal connection between a body part. So the fistulas that I'm concerned about or that I'm talking about are specifically an abnormal track between like the uterus and the bladder, or the vagina and the ureters, or the connection between
like the tunnels and tubes that
exactly. So anytime there's a connection between your reproductive tract and your urinary tract, or your reproductive tract and your bowel, that is an abnormal connection. So back to what I was saying with the experimentation, the reason why we know how to repair these types of fistulas is by the experimentation on Black bodies. Like women were either had fistulas to begin with or were given fistulas, and they were able to try to see how they would repair it and things like that. So needless to say, so we know that the historical context of Black and brown bodies is based on this experimentation, and that obviously has influenced the amount of trust that we have in the medical system as Black women. And the only way to dismantle the that lack of that relationship and that what we see in that patient interaction is to be able to listen to our patients, is to be able to understand our patients, ask questions, to be culturally competent. And what I've always strived to do as an OB-GYN is to make sure that when I'm sitting down with a patient, especially a Black and brown patient, I take time to listen. That's with all my patients, like all around, but we have such different stories, and like everything that led them up coming to that appointment were completely different, right? My story is different from your story, which is different from the other Black woman's story. So you have to meet them where they're at, and you have to understand whatever path that they're coming from. It's very unique, and it's gonna play a role in how they interact with you in that patient encounter.
That's really a snowflake pussy for you. Like everyone, I really feel that and really do receive that, especially when I think about how like Black women like fed white, like they masters children. Like that's like one idea of like birth to me, but I also think what she was talking about, the testing their strength and testing their endurance, the idea that like Black people are just like a lot more stronger and really wanting to like, you know, like you said, test and experiment on us, right? We were talking off record about epidurals and like my dream birth, guys. I wanna have a water birth in the middle of my living room with like it has got to be a vibe. Like it's gonna be a vibe. I want a camcorder. It's gonna be incredible, but Dr. Britt said, you can't have that, babe, if you're high risk pregnancy, right?
So I said it with the caveat that If you're low risk, I'm all for it. Meaning
Right.
you have no medical conditions, like you are, living your life as this healthy woman that just so happens to be pregnant, not having any complications during your antepartum experience, your intrapartum experience, and that means like your experience while you're pregnant, your experience during the laboring process. I want you to do whatever your heart and soul desires.
Right.
But I will say that if anything happens during the time of your pregnancy, like let's say you're diagnosed with high blood pressure issues towards the end of your pregnancy or diabetes or...
You can get that in the middle of pregnancy?
Absolutely. You can get diabetes and high blood pressure because you're pregnant. We test and screen for those sort of things like throughout your pregnancy.
I don't want to go on a tangent, but I hope I can come back to that.
Yeah, we can rewind later.
Yeah.
But so as long as it's uncomplicated, I want you to do whatever you want. Not to say that like I'm promoting it, but it's your prerogative, it's your body. I would say that, again, if anything becomes more complicated during the process of you being pregnant or during the laboring process while you're laboring and actually having the baby, then I think that's an appropriate time to get a higher level of care involved. So like being in a hospital system.
So you talked about trust, right? I think one of the reasons why I am so passionate about a water birth is because it's built on trust. Like, one, you're not having nobody in your home that you don't fuck with, at least not around a baby.
Yeah,
not around where I'm
that is
gonna
true.
push this cooter out of me, right?
Yeah.
So with that intimacy, how can intimacy be built in a white-walled, chlorophene-smelled institution?
Ooh, that's a good
one that
question.
historically, like, isn't the most friendliest.
Welcoming. Yeah, that's actually a really good question. I will say it's hard when patients come in and they do want to have like a little bit more of a trusting experience with their OBGYN and the medical team, and want to have that ambiance that is a little bit more warm and welcoming and loving. So this child is being born into that love, into that welcome, into that trust. We try to promote as much as we can, like them having like a playlist, like the lighting, like all of those components.
Oh, we get lighting?
There's some lighting that y'all can change up the lighting a
So
little bit.
I can have my
There could
baby
be
in a
some-
pink lit room.
If you wanted to, we've got some strobe lights going on up there. People got their own playlist going on in there. The father of the baby, mother of the baby sometimes will be dancing up in there. So,
Okay.
you can create an atmosphere as much as you want.
Okay.
Obviously, it's not going to be to the same level of you being at your house
Right.
in your bathtub.
Right.
It's not going to be that intimate.
Right.
But you can create a level of intimacy to an extent while you're at the hospital.
Is there a difference between like a doula, a midwife, and like you, right? Because I imagine like you said something profound, like, well, we don't deliver the babies. Women deliver their babies. We're just here to like assist and guide. And I thought that was very, very beautiful.
I mean, that wasn't even from me. That was actually from, I forgot her name now. That was actually from a midwife that had given us a presentation.
Oh.
And midwives honestly are the truth. So there's a difference between all of us.
Okay.
So midwives are birthing people. Like they are the ones that help with the birthing process. So they help with the delivery of babies just as OBGYNs do. And then but they're like they go through like a nursing track. So after they become a nurse, they become like a nurse midwife.
Okay.
So it's like an extra level of training, and they're equipped to do not as much as like an OBGYN, obviously, but equipped to deliver babies, repair lacerations, tears in the vagina if they are present, and manage a lot of their care leading throughout their pregnancy and in the postpartum period.
Okay.
So midwives are very active in that sense. Doulas are a little bit different. They're not helping with the delivery of the baby, but they're really that support system that is really needed for all women during the laboring process and in the postpartum process as well, because it's all hard. So they are the ones that are helping the woman cope with all of the different changes their bodies they're experiencing as they're progressing in their labor progress. And then honestly being an advocate to the patient when when the midwife or the OBGYN or the nurse is coming in and suggesting plans and management things. So they're the ones that are going to be sometimes asking questions like, well, why is this needed? What is an alternative? What are the risks associated with getting this?
So your doula should be your ride or die.
Your doula is your ride or die. And if she's not your ride or die...
Your ride or doula.
Your ride or doula. If she's not your ride or doula, then she ain't the right doula.
Okay.
Yeah.
And so, like, can a doula exist in a hospital space?
100%. And we promote that doulas are in the hospital space, especially Black and brown women.
Oh, that's fire.
Yeah, it's bomb.
So about epidural, right?
We're coming back to this again.
Because, like, here's my thing. I ain't no bitch. If my ancestors... Yeah. Yeah.
Well.
I can't even hold you. Let me shut the fuck up before God decides to strike my ass with a 72-hour labor.
Girl.
Like, on some real shit. But I'll be like, if my ancestors
did this without it, I know.
just biting on corn and leather and shit like that, trying to get through it, then yeah.
Trust me, I've heard this exact rationale. My whole thing is like, if you have those resources available, you will utilize it.
I don't want my baby to come drugged out. I don't want you to come into this world drugged up.
That's not how it works.
I'm not producing a roux here.
That's not how it works. It's very minimal effects, if not any, to the baby at that point when the baby is born. It's only when we're giving other pain medicine that crosses the placenta where the baby can be drowsy. But in terms of the epidural, it's safe for the baby. And it's an option. Like, if you are having intractable pain, meaning pain that like you are getting literally no relief and you're only 2 centimeters dilated, I need you to get the epidural. Because you need 10 centimeters to have the baby, and that's going to be a long road if you are already complaining about the pain and you only 2 centimeters dilated. And
I feel like I have a dick. That's just uncomfortable.
It's hard, but...
I heard that it's a very long needle that they put in your spine.
I wouldn't say it's like super long, and it doesn't stay in your spine. So that's only for them to place it. Okay. And it's not that long of a needle. And the people that do, the anesthesiologists that put epidurals in, this is a procedure they do multiple times a day, all day, every day. So you are undergoing a procedure that is extremely common, and it's an option. It's an option for pain control that I always offer to my patients, and if they want it, they should get it.
Are there like natural epidurals? Like, what if I come in like off the hibiscus, like off the extra virgin olive oil? Like, what if what's like a good natural way to lubricate your vagine before the baby? Like, do I spray a bunch of Spam down there and like let the little sucker fly out, or like is it? I know like maybe what's that stuff that she be taking? She said something. She was taking something to relax her pelvis. Like clothes and these, it's some natural. Do you know any natural remedies that like help with childbirth?
Yeah, I would say the biggest thing in terms of pain and preventing tears, only evidence-based things that you can do to prevent that or to assist with tears are something called a perineal massage, where like in your late second trimester, throughout your third trimester.
As a pussy massage?
Virtually someone is massaging.
I know that's right.
The lower part.
I know that's right.
Vagina. Yeah. To get those muscles like kind of ready and primed for what's to come.
So you're getting fingered and prepped for your child.
I wouldn't say necessarily. They're not that deep. They're like right at the opening and the lower part.
That's all I need. That's all I need. I need right at the opening.
You would think that it's comfortable, but it's not, because at that point,
because of the baby head.
Yeah, it's actually not that comfortable for patients, but we still say that it is something that you can do that's natural, that can help with prevention of tears when you are laboring. The other thing is doing warm compresses during the laboring process. So while you're laboring, it's like literally heating up a towel, like a moist, hot towel, and putting it up against the perineum. That also is going to help relax the muscles, be more natural. So those are things that can kind of help in a more natural way while you're experiencing pain in labor.
Now about tearing.
Well.
No.
It happens, girl. It's
Does
natural.
it? No, that is not natural.
It's
a tear is the most artificial thing you can have. And when you get a piece of paper, it comes to you as a full sheet of paper, and we destruct it.
Well, then you need to talk to your child about that, because your child is going to be the one that's going to be causing the tear as it exits the birth canal.
But when you say tear, like how terrible? when you say tear, how terrible are we talking?
It just depends. So sometimes, depending on if the patient, it's the first time mom, or it's a mom that's had multiple kids, the level of tear will be different. So we do it by like a 1st to a 4th degree. A 1st degree is like a skin scrape. So if like there was like a nail and it like went in and it kind of opened the skin a little bit, that's a 1st degree.
Okay.
A 2nd degree is a little bit deeper. 3rd degree a little bit deeper, and the 4th degree is a direct tear,
Like booty hole.
from vagina to.
Have you ever seen that?
I've seen it once. My first year of residency, I've seen it one time. So we repair it.
Oh my God.
We repair it.
So you get a vaginoplasty in return.
Well, not necessarily. It requires so much. It requires so much follow-up. You have to go be seen by like specialist doctors to make sure you're still having normal bowel function, because that's the biggest thing, is that your bowel and you're able to like control your stool afterwards. But otherwise, we repair it to the best of our abilities, and then they see a more specialist OBGYN or specialist gynecologist that'll make sure that they're still able to control their bowel, and to see if they need any additional procedures if they can't.
You know, well, thank you. Y'all just got some free birth control right here on the Real Hoodwives Chicago.
Yeah, when I explain that, it usually is some birth control right there.
In this climate, you should listen to the show if you need some birth control. Can we talk a little bit about like sex during pregnancy?
Yeah.
How is it recommended? Like,
so it depends.
Does it exist? Is going too deep? And can you poke a hole in your baby's head?
Oh, sex during pregnancy.
Yeah.
So, there's nothing against it. People still do it. Obviously, you might have to switch up the positions a little bit because, so you might have to.
I don't know.
Well, there's a pregnancy, so, certain positions may not allow
be possible.
Okay.
So
you may have to be just creative with how you choose to engage, but we don't say that's off limits during pregnancy unless you've had a procedure called like a cerclage, where it's a surgery on the cervix, where we wouldn't recommend you having intercourse. 9 months without some sex? Yeah, I mean, they usually get it in the beginning of like the 2nd trimester, so, yeah. Yeah, and that's just to prevent them from going into labor, so.
Because they can go into labor early. Can the dick break the
stitch? So that's why we say, like, hey, like, you can't have intercourse unless, like, you're going to go into labor and possibly baby may not survive. So we say nothing per vagina if they've had that and this is, like, a very specific patient population that would have this surgery. But otherwise, those that don't have that surgery they can do as they're pleased as much as they can tolerate. Okay. We actually say towards the end, like, around, like, 38, 39 weeks, 39 weeks, I should say, that the intercourse actually assists with them going into labor.
I was just gonna say that. Like, if I'm like, take some dick to make the baby come out, I would love that, right? But wouldn't that theoretically be kind of challenging because the head is pushing against the wall? So how would it like?
So that's what I'm saying. People get creative. People get real creative. So
is it the orgasm that makes you assist?
Yeah, the part of it, the arousal, the orgasm, all of those things are going to be an assistance with you going into labor.
I get it, because your pussy's engorging.
If you want to say it like that. Yeah.
What is it? Because
I don't know the exact, like, specific physiology behind it, but it has to do with the arousal, the orgasm, that are all going to be components to promote you going into labor. Okay. But there's other things besides us telling you to have sex. But that is one of the ways that, we can get you to.
Do patients be getting it on in the hospital?
They do.
Oh, really?
They do. I mean, I wouldn't say it's something that we see all of the time, but I've seen pregnant women and women who have and like people who have had the babies, postpartum women have,
Get it.
Good for needs them. That they needed to have.
Good for
in
them.
The hospital, but it happens.
I would love to fuck in a hospital.
I don't know if your provider would want you doing. Well, I don't know if they want to see that.
But have you like?
I personally have not seen it in the hospital,
But it's like something you hear.
Something you hear about.
Is it a such thing as screaming too loud during labor?
No. Okay. I mean, there's some screams where I'm just like, whoa, like this is a lot. But for the most part, like I'm able to tolerate a lot of screaming, a lot of yelling, and so to me it's not a problem. But I'm sure it's a whole unit. So if someone's like walking across the room and hears screaming, they're probably appalled by it. But for me, it's just like, she's in labor, so you don't know how that feels because you're not in labor right now.
Yeah, I'm. Thank you for touching on that, of like just very, very much advocating like what someone could really be feeling, because I think that like afterbirth is like kind of glamorized. Like people only appreciate mothers like for the glow, for the belly, but then like when it's like she's stressed sitting on a yoga ball and got like 18 loads of laundry and like dried milk behind her ears and shit like that, like it gets tough and challenging. I was just talking to my mom about my diagnosis, and she had shared a story of like how she had went through like a similar depression after me. And that was honestly my first time I really heard my mom speak on like mental health that she associated with me, like woman to woman, without being like scared of it, right? Can you tell us like what's like some like the dark side of like postpartum, of like of motherhood that really isn't wanted to be discussed?
Oh wow, that's actually a really good point. I do feel like women who are pregnant, it's not even so much that it's glamorized, but people are like bending over backwards for pregnant women, which they should. So, seeing a pregnant woman on the street, people are going to give that woman a certain level of, privilege, because this is a vulnerable population. Ooh. And we need to watch out for our pregnant women, period. But I will say that whole dynamic shifts after the baby is born. And there needs to be a little bit more emphasis on what's going on in the postpartum period, because there's a lot of emphasis now placed on the baby, and now everyone's looking at the baby for, that joy again. So they saw the joy of the pregnancy, or at least witnessing the pregnancy, and now they're seeing the baby and they think the baby's so cute and amazing. But no one is really asking how mom is doing, how their body is reacting, how their mind is. And I think that is the most important part. And that's what makes me so privileged to be in this field, is that I'm able to dive into that a little bit more. So obviously, postpartum depression is very alive and real. And I probably if I see like 5 postpartum patients in a clinic one day, at least 2 of them will have signs or symptoms of depression. One will probably we would need to talk about starting medication, because the coping is so different from, when they're in that postpartum state. And especially if it's a woman that's already had a history of an anxiety and depression going in, they're even more at risk of developing even more so in the postpartum period. So it's so important that we actually had that conversation with our moms, like beyond how baby's doing, beyond how, their bowel and urinary function is. Like I actually try to spend more emphasis on like, where's their mind at? Like, how are they coping? Where are their resources? Do they have people that are helping them out? Are they supporting them? Those types of questions are probably the most important, because if people aren't supporting mom can't support baby. Period. So it's really important that we understand the dynamics between mom's social relationships, whether that be with the father or mother of the baby, or it be that, if they have any social issues regarding transportation, diapers, car seat, those types of things, and really do a deep dive into the social aspect, because that also is contributing heavily to their symptoms. And then also being able to take the next step with offering them management options to help cope with their mood. So whether it needs to be therapy, psychiatry, or they need to talk to social work, or they need to talk to someone and build those connections that way, are the that's what I try to promote when I see them in that postpartum state.
And that's why spaces like the Breathing Room is important, guys. So please support the Breathing Room and the Let Us Breathe Collective and Dr. Britt, who is really on a mission. To that, the connection or disparity, I don't know if that's the word I'm looking for. Like when I think about Black mental health, it's already a rare commodity. Like the real conversation of like the generations before us is very rare.
It's very real.
So I'm thinking like, how short is that circuit to be depressed before a baby and then to be even more depressed after a baby, but Black depressed, where it's like an even more darker and like vamper thing, right? Like
100%.
And then also like with the vices, because you can't really depend on your vices after you have a baby, right? Because you have to breastfeed, right?
Yeah, it kind of depends too. Like if we do want you to breastfeed at least for 6 months, but then again, you know, there are some medications that we don't want you to be taking while you're breastfeeding. But that being said, if you are on a medication that is like literally stabilizing your mood, then, you know, like the benefit of you taking that medication outweighs the rest. So we would probably have you, you know, talk to you, it's joint decision making always, about the option of just doing formula feeding so your mental health can be taken care of. Because the best scenario is a well-fed baby, whether it's from your breast milk or whether it's from formula. So yeah.
Someone told me that like, or they had, I guess I try to be as pro-natural as I can.
Yeah.
I'm a very crunchy, earthy, witchy kid.
Sure.
So like the idea of like formula feels fraud to me. But I understand that every mother can produce.
Yeah.
I understand that. And also, you know, she may be wanting to save her tatas for herself.
Yeah, it's whatever, it's your prerogative. Like that, we always say like at least 6 months after birth, we recommend you trying to breastfeed as much as you can, even if you have to like supplement it a little bit with the formula. But there's so many formula has gotten so sophisticated nowadays.
Has it?
Where there is obviously still built-in benefit to the baby.
Is it?
Like I said, a well-fed baby is the best scenario.
But I'm feeding them like pencil shavings from factories.
Not exactly.
But on the flip side, I feel like if I breastfed my baby, I would need to make sure I'm the most healthiest ever. Like,
100%.
Because like I do so many things.
Yeah,
right?
100%.
Like,
I think that is like the best way to actually like cleanse at that point or to be completely on top of it in terms of your health. I was just actually having this conversation the other day with a patient because they felt like they weren't producing enough. But even we were going through their diet, you have to be mindful of even your caloric intake. A lot of us like undereat.
chlorine?
Caloric intake, like the amount of calories you're taking in on a daily basis.
Caloric.
Yeah.
Okay.
So, and good calories too, some from like whole grains, vegetables, that sort of thing. So making sure you're not under eating and making sure that if you are eating appropriately, you're eating the right nutrition to make sure that you have what you need to develop that supply. And then being able to not only produce quality milk, but the amount of milk. So to help with that, there's like lactation consultants that help with you being able to express breast milk, baby latch, things like that can be super helpful to the overall breast milk or breastfeeding process.
So one of the dark stories that I've heard about after birth is a titty clog.
That can happen. I would say the worst case scenario is you having an infection of the breast, where your breasts get really big and they hurt and they're red and tender and it's really bad.
Really?
Yeah, it's really bad. It's called mastitis. And it's not infrequent that it can happen to our mamas. So we give them antibiotics and it should go away, but that's probably like one of the worst case scenarios.
Oh my God, I am in so much pain over here. I am physically uncomfortable.
I know. I told you it's the best form of birth control.
It really is. I actually want another drink probably. Do you want your drink?
Oh, yeah.
I'll get it for you. Okay, no problem. I forgot what I was finna ask you, but one of the stories I heard about unclogging a titty is that you have to dip them in bowls of hot water and then like get them ruddered out to get the clogs out.
Yeah, I mean, I don't know about that second part, but we definitely want you to use like warm compresses and actually increasing the frequency of your feeding to help with those clogged pores. So yeah, it's something that we see commonly, but I feel like women for the most part manage it well.
If we can, while we're talking about the dark side of things, I want to talk a little bit about like my worries of fertility, right? So I'm a very fun spirit person. Like I have no shame in having my fun and doing the things that I do. You know, we've talked about them, but you're also a doctor, and I've also asked you about like the problems of like drugs on my heart and things like that. And I want to know, like, as someone who has been around and been in many things for a long time and still participates in like many like substance proclivities, like what is the long-term effects of that on my reproductive health and on my body? Because, you know, I don't want this to be a platform where it's like, oh, I'm glamorizing and glorifying having fun, but I also want to talk about some of the fears that I have of like what I'm doing to myself, what I have been doing to myself for a very, very long time, like drinking every Monday, like, you know, or every day, like, you know, at what point do you start to think about it and like, honestly, like, where should my head be at, or what can really go down and happen?
I think what it comes down to is like the amount and frequency at which you're partaking, and not just as it pertains to your fertility, but I would say just your overall health, because your overall health is going to play a role in your fertility, period. So being mindful of whatever substance, whether it be alcohol, whether it be drugs, especially hard drugs, those are always going to be a no bueno in regards to your overall health. In regards to alcohol, I always recommend like kind of the CDC recommends, which is like a drink, I think 1 drink for women per day.
1 drink per woman, so I could drink every day, just 1. Perfect.
You could,
So,
but
I'm not gonna. Don't do that.
Yeah, don't do that though.
Do not
so, like,
do that.
You know, everything in moderation, sort of thing.
Okay.
So I would say, as long as you aren't to the point where you develop a dependency on a substance, I think, and you're not seeing any type of medical or like you develop a medical condition because of those substances,
Right.
then you should theoretically be okay. It's only when you are doing it to the point where you develop a dependence or an addiction, because then it's going to play a role with not only your medical health but also your mental health. And then you should also be mindful if like you have any medical conditions at a baseline that could worsen with you doing drugs, alcohol, and things like that. So it's really, I think, from an overall health perspective and being mindful of that when you are trying to get pregnant. Okay.
All right. Are you familiar with the story of Pam Grier and Richard Pryor? He used to, the story that I've been told is that Richard Pryor used to do like hella cocaine like off of her butthole, and she ended up getting a uterine cyst and was not able to have children. Now, I'm not a stripper in Vegas, so I am not getting cocaine sniffed off of my butthole. Would I? Absolutely. Guys, you could definitely sniff cocaine off my butthole, right? I would do it. But it does make me think about like, of course, it makes me think about like with everything that I take in myself, like, is it going to my heart? Is it going to my brain? But like, does drugs have an effect on like our uteruses and reproductive health and things like that?
It can, but I will say everyone's body is going to react a little bit different. Like, there's no hard and fast rule that we like say to our patients, like, yeah, if you drink or if you smoke or doing hard drugs, like you are 100% going to have this effect on your uterus or your ovaries or your fallopian tubes. We're more so concerned from like an infectious standpoint and an inflammatory standpoint. So any type of like infection, inflammatory things, those are the things that we're kind of more worrisome for us when we think about infertility, when we think about fibroids and things. Like if you have like an untreated sexually transmitted disease, you could have issues with your fallopian tubes, and that could prevent you from getting pregnant. Those are the kind of things that we're more worried about.
Okay.
But I will say I don't really see a whole lot of women that have issues with substance use.
Okay.
So it's not a conversation that I have very commonly, but I don't think there is going to be a safe amount that I can tell you, like, yeah, if you do this amount, you should be good.
Yeah, there's no like surreptitious idea.
Exactly. There's no like hard and fast rule, like, okay, if you do this and that, then you should be good, versus if you know, like, everyone's body is going to react completely differently. And it depends on where you're at a baseline too.
I think that's a fact. An apple a day keeps Dr. Britt away from you.
Right.
Dr. Britt. I mean, like, I need a doctor. I haven't been to like a doctor, like the one that like puts the stethoscope on my chest and like makes my knee bounce and shit like that.
Sure.
Like, I haven't been to one of those
In a hot minute.
Yeah.
How old are you?
I'm 26.
Okay.
I'm 26. No. Don't get me wrong. I go to Planned Parenthood.
Oh, okay.
I go to Planned
Parenthood is the truth.
Planned Parenthood is the truth.
Planned Parenthood is the truth.
Planned Parenthood is the truth.
Don't knock Planned Parenthood. We promote Planned
No,
Parenthood.
I go to, that was my doctor. That has been my doctor
Honestly,
since I was a teenage year. But like, as far as like blood work and diabetes and like, you know, like the body shit. Like, I want them to tell me how much like gristle I got around my liver and things like that.
For sure. That's actually really good. That's actually a really good point. And I will say that if you're an overall pretty healthy woman, and the only, which it sounds like you are, so kudos to you, and your only real concern is like more so your reproductive health, and Planned Parenthood is the plug, really.
Yes.
And honestly, I tell a lot of my patients, like, if you can't get into our clinic, just go ahead and book an appointment at Planned Parenthood. They can see you sooner, and they can do STD testing, they can do abortions, they can do ultrasounds. Like, they literally can do everything. But when you have a medical condition that requires like
Extra
workup, management,
extra work,
then that's when you should start getting like your OBGYN or a primary care physician involved. Or after, I feel like the age of 30 is like an appropriate time to start getting some of that just like routine screening, like looking at your blood work and your thyroid and stuff.
Is it ever too early of an age to start thinking if you're infertile? Because I've only been pregnant once. I've only had an abortion once. I guess this is a two-part question, but like, is it ever too early to think about if you're infertile? I know that like breeding kinks are heavy. I personally do not have a breeding kink. I am not the type of person when I be fucking be like, come at me, and don't mean it. Like, no, do not come at me. Do not come inside of me. No. I may say it if I really feel it though, and then I'll get a plan B and know that we got 72 hours to make it pop, right? Sure. But like, I do wonder like if my abortion may have played a part in me not being able to get pregnant in the future, even though if it was success, I noticed it was successful, but I've you know, some like for color girl shit, like get a abortion and you can't have kids anymore, or it was like the game, you know. It
shouldn't. It really shouldn't, especially with just one abortion. I do think it's probably important to have that conversation on the earlier side. If you don't anticipate them in the next like 2 to 3 years, then we should start getting into the conversation of egg freezing. So not to say that you are infertile.
You talking my business now. You talking my steez. You're talking my steez. Yes.
Not in the business that I think you're infertile, but in the business of, I want you to have ownership of when you have kids, period.
Right.
So in order for you to be able to have that ownership, egg freezing is probably your better option, especially if you single, especially if you
being Mary Jane. I don't want to continue on that narrative. I'm sorry.
30s. So that way you have a little bit of an option when it comes to the timeline of when you want to have kids, and you won't be able to have to make decisions of your partner based on the fact that your fertility clock is ticking.
That's literally being Mary Jane, right? I'm not continuing the stereotype that Black successful women are single and can't be married. I'm not continuing that.
Me neither.
But Gabrielle Union was way ahead of her fucking time.
She was.
Like, to see that shit that was like way ahead of its time.
Yeah.
I do think about egg freezing. I want to sell my eggs. I heard them bitches go for $30,000 a pop or more.
$30,000. I think a couple thousand.
Come on, tell me to raise my price. You only gotta tell me to raise my price one time, and it's going up. I need that house. I need that farm. If you are a white, no, I don't want to give my black eggs to a white family.
Your eggs, girl. Your eggs are gonna be so precious.
No, why would I give a white family my black seed?
Yeah, no, I'm just saying in general. I feel like your eggs are gonna be so precious. Like you're gonna have the prettiest kids.
Yeah.
So I feel like your genetics, you just need to save that for you and whoever you with.
I want a black man to squirt his. I need all that black cum inside of me. I need that tall, chocolate, dark skin, big nose, big lips, nut inside of me. I want it inside of me and on my face.
And you want some black kids.
I want some black ass kids. I want some beautiful chocolate babies, like some chocolate ass kids that's just like.
It's clear as day that these are some black kids.
Yeah.
That's how I want my kids to be too.
Yeah.
Like, I don't want my kids to be like, are they? I want my kids to be like, no, they black.
Yes.
They
but
black.
when you sell your eggs, you can also sign a paper where like the kids can meet you later, right?
Yeah, exactly. So it becomes a little bit more complicated, but there is an option for you to be able to have contact with whoever is choosing to take your eggs. So it just depends. Everyone's a little bit different. Some people don't want to have that connection. Some people do.
But like, isn't that like, I just feel like that process is so like, I know the freezing the eggs is probably a more personal thing, but like to sell them, I know that screening process is a lot more strenuous.
Yeah.
Damn near racist, no?
I mean, the types of questions that they're going to ask when they go into the process of you trying to sell your eggs is pretty intense. So I don't know the exact questions that they ask on the screening, but I'm sure there's going to be a little bit of implicit bias that's going to play a role with the kinds of questions that they ask, unfortunately. But they ask reasonable questions. They ask about like your STD history. They ask about drugs and alcohol. They ask about things someone would want to know if they're going to be buying someone's eggs. Just like how if we were to buy someone's sperm, we would want, sperm that is of the highest quality and has the purest sperm.
I don't necessarily want the Teslas of sperms, but I want like I want like a good vintage, something good vintage wood grain, like leather seat, cream leather seats, like something that's like, some Bone Thug shit, like some real like.
And you can find it. You can find it.
So if I sell my eggs, like you think I could sell my eggs?
If you wanted to, you can try.
How easy is it?
So that's the thing. Like you would have to still go through the whole process of egg freezing, which is not an easy process, and that's why it's a little bit more expensive. Well, it is more expensive to sell your eggs than to sell sperm, because men just have to
come in a cup.
Correct. Women have to take drugs, inject themselves for weeks, and then go through a procedure.
How do you extract the eggs?
So they give you like sleepy medication, and they make you really drowsy and not remember anything, and they put you to sleep. And they insert like a probe through the vagina, and at that point your eggs
through the hole or through the urethra?
No. You through your vagina. Okay. They go through your vagina, and then the highest part of the vagina, that's where your eggs have probably dropped a little bit.
Like your G-spot?
No. It's inside the vagina. Deep in the vagina, almost where it's kind of hard. We'd have to like draw a picture or something.
No, I'm there.
Yeah, you're there.
So it's the vagina.
It's the vagina.
Majora minora, clit, urethra, hole, right?
In the hole.
In the canal.
In the canal. Back, in the very back. So yeah, then you're at your cervix. And then just to the side of that is called like the vaginal fornix. It's like like where your vagina ends, where it kind of meets the cervix. That's where they're going to put a needle through that area, and they know using ultrasound guidance, they can see your ovaries, and they just suck up everything.
It probably looks like a little anemone, like the little Nemo, like with all the little eggs, right?
Yeah, kind of. It's like all these little circles, like a bunch of circles, and your ovaries are really, really big, and they suck them all up, and
That's
how they
actually
do
fire.
it.
I don't know if anybody, like, when you bleed on your period, have you ever, like, bled on your period and, like, opened up your pad and then to see, like, what your, like, blood looks like collected together?
Yeah.
I'm really, whenever I get, like, a really good blood clot, it's required of me to examine it. Like,
Oh, yeah,
I have to,
100%.
like,
You should.
I'll be like, what in the squishy red earth is this? Like, it's really fascinating to, like, kind of, like, unearth yourself.
Yeah.
And, to pick yourself apart and see it like that.
Mm-hmm.
I really wanted to know what, like, eggs look like. I imagine it looked beautiful.
I think it is actually very pretty. I mean, I think the whole reproductive tract is pretty. But I have a bias. But it is actually very beautiful to see, especially honestly seeing the excitement on the woman's face when they see all of their eggs and knowing that all of those eggs, like, are potential, right? Like, that's going to be, either a future child for someone else or for yourself. And, the more the merrier, the more you get the merrier. And it's beautiful to see on the image and on the woman's face.
I love that.
Yeah.
If I can check in with you for a minute, I want to ask, how's, like, your heart and your mind and, like, your role, especially in this climate? I can't imagine what it's like to be a Black doctor, a Black femme doctor in this world, in this climate right now with, like, the whole political football that is being tossed of us.
Yeah.
And also maybe, like, if you can talk on, like, delivering bad news, especially in this climate too. So I just want to have a check-in.
Yeah, that's actually a really good question. I will say that I have to check in with myself personally to understand, like, what am I feeling in this instance? Is this a conversation that I need to have right now? Or should I have this patient come back? Or should I, exit the room and have my colleague kind of help me with this conversation? So I have to check in with myself, my mental state, to see if I even am at capacity or if I have the capacity to deal with whatever conversation or situation that I'm dealt with. 9 times out of 10, though, I do feel like, after I take a moment, whether it be a couple seconds, a couple minutes, I do arrive to a spot where I feel like I can show up for my patients in that way. But it's tough, having conversations about patients and their babies or bad outcomes that may come about after the delivery of their baby, or having conversations about, infertility, or having conversations about, women taking out their uterus. Like, I remember there was one woman that was, like, very, very, or I've had several women that have been very, very emotional about losing that body part, because people attach, like, their womanhood to their uterus. Which makes sense. So, women will have, a moment. They're like, will you take a moment just to, like, pray or take a moment of silence, like when you are removing my uterus, or if I'm delivering, like, a baby that I know is going to be demised, or a baby that we already know has died. Yeah.
You've delivered dead babies?
Yeah.
Oh,
it's sad. But I will say that, it really puts it in perspective. I think with just my life view in general, like, nothing is ever that deep to me as much because of what I've seen with what I do.
You've seen some shit.
Like, I know what people, especially women, have gone through in terms of birth trauma, in terms of losing babies, in terms of losing their organs. Like, I've seen situations where people are in life or death situations. So all of the more frivolous things that I encounter in life, I will say I treat it with a grain of salt. Like, I don't let things, especially things that are outside of my control, that are outside of, like, work, like that guy cut me off, or I got to, this place late. I try to treat those things as very secondary when it comes to, like, the grand scheme of things. Like, it's not that deep. Like, I'm not dying. I'm not dead. I am okay. I woke up this morning. I'm alive. I'm breathing. I'm well. I have a roof over my head. I have food that I can eat. So there's a certain level of gratitude, honestly, that I feel probably every day when I check in with myself, because I know the situation can be worse. It could be worse for me. It could be worse for other people. It could be worse for my mom. It could be worse for my sister. So it's really from a place of gratitude that I have within myself, that I have against my friends and my family members, that I approach life with and I approach my day-to-days with. And really giving thanks to God that I'm alive and well, because I know the possibilities of all the things that can go wrong.
It's so beautiful.
Oh, thanks, boo.
I'm really happy to be in this episode with you, especially during this time.
100%.
I know that time doesn't exist in the world of film, but in this month specifically, at the end of this month, it will be my due date anniversary. And if my child was born, I would have a whole 7-year-old.
Wow.
That shit is insane to me.
Wow.
I could not imagine having a child, a 7-year-old child right now, but that's why this episode feels just very special and very bonded. I've actually been talking a lot about parental things lately with folks lately, and it's been really good. That's been really helpful to my feminine energy.
For sure.
I really appreciate the support.
Oh, of course. Always.
Yes.
Always.
Can you tell me, like, did you always want to be a doctor when you was like, when people ask, what do you want to be when you grow up?
I knew I wanted to be in the medical field. I didn't know to what capacity yet. When I was in college, I was kind of navigating different things in terms of exposing myself to the medical field and shadowing nurses and doctors and PAs and understanding each role within the field of medicine. And I realized that I want to be the person that's making the final decision. So when decisions are made, when there's a discussion, it's usually that doctor or attending doctor that's going to be making the final management decision on what they're going to be doing. And honestly, it really is so beautiful because it's not a decision that they're making really, it's a decision that the patient is making. And in order for patients to have the empowerment to make that decision, that's on us. So being able to empower patients in that way to make a decision over their body and helping them make that decision, no brainer.
Yeah, I love that.
No brainer. So when I found out there was a specialty that only did this for women, I mean, no offense to men, but like,
I don't know how I feel about having a male OBGYN.
Yeah.
My aunts, when I would hear that they were getting like pap smears appointments and things like that, I would ask them, I was like, you have a man doctor? Do you have a man doctor? They feel like men are way more gentler. And I'm like,
maybe.
I don't know.
I personally have never had a male OBGYN, but I mean, the field of OBGYN used to be completely male dominated. Like 30, 40 years ago, like it was completely all males.
Can I tell you of this rabbit hole I just went on of why it's fuck men and fuck niggas? And do you know the reason why morgues mainly hire women?
Why
like,
who?
Morgues, like mortuaries.
Yeah.
Mainly hire.
Girl, that's a shame.
That's a fucking shame. Because I really thought, I was like, oh yeah, morgues really do mainly hire women. Yeah. Like, niggas be on some like fucking
that's
creepy,
demented.
demented shit.
Yeah, that's really demented.
Do you find that like most women like gravitate, like, is there like men in your field?
Yeah, there's a couple like male OBGYNs that I know. And I mean, they're great. Yeah, they're great. They're very patient. They're very gentle. And I feel like they treat the patient just as like my female counterparts. So I personally haven't really noticed a difference with a male provider and their treatment towards their patients versus a female. But obviously, like every patient's experience is going to be a little different.
Can we talk a little bit on a personal tip, right? You're a very successful Black woman. You're a Black doctor, and you be delivering Black babies.
This is correct.
Does what you do ever make you reflect on your own personal life? Like, maybe give you pause to not want to have kids yet? Or maybe, you know, think about having a family sooner? Or make you, like, think about your career versus your job? I think that's something that Black women often deal with themselves. I know me personally, I'd be like, the nigga gotta be on my level. It's too much. It's too fucking much.
I think it definitely does play a role. It's probably something I think about every day because we have those conversations so often with our patients. So, you know, as I'm talking to my patient, I'm like, man, I'm like almost talking to myself. Like, what am I doing that needs to be assessed and managed? So a lot of times after that patient encounter or in between those patient encounters, I'll have these conversations with my colleagues like, oh, look, girl, like, can you do my pap smear? Like, it was due like 3 months ago. Or, oh, look, girl.
That's fire.
Yeah.
That sounds like a tattoo shop.
I know. I mean, we look out for each other. Or like if we like are thinking about fertility things, like, hey, can you like measure my hormones? I just want to make sure I'm good. You know, things like that, because we've already know like the role of hormones and things like that play a role in fertility. So we have those conversations so often. So we know the management, we know the treatment, we know how to assess patients for these things. So when we're having symptoms or having questions ourselves, or undergoing like any type of clinical suspicion that we may be diagnosed with something that we just diagnosed our patient with, then we're going to be like, oh, okay, I should follow up on this. So I will say that every day, honestly, every day after I talk to a patient, like I'll say something to them and I'll almost like also apply it in my own life. Like, oh, Britt, you actually need to follow up on that too. So practice what you preach almost.
Does your profession kind of change the scope of like who you date in your dating scene? Like, do doctors have a dating scene? I imagine doctors' dating scenes are crazy.
Mine's not crazy, but I'm sure people's are.
So it is a doctor dating scene.
I feel like, so you agree.
Yeah.
I mean, there definitely is a doctor dating scene. Like, are you saying like doctors dating doctors?
That's hot. I mean, like, not to be sexist, but like if we like do want to like a little gender role play, right? Like the doctor and the nurse situation, but you a doctor though.
Sure.
But you are a doctor though. So it's like, you know, I mean, personally, if I was a nigga, I mean, I am a nigga, but like if I wasn't, like if my dick was a little bit bigger, like I would definitely be trying to wife up a doctor.
Yeah.
I would definitely be trying to wife up a doctor.
I will say, based on my own experience and the experience of the female providers that I work with, that is like not the case. I think there's an intimidation piece that comes along with, obviously, with you being a female doctor versus a male doctor. You know, not to say that women are throwing themselves
but
at them.
glory be to the male doctor.
Glory be to the male doctor. Like, can you imagine like a woman bringing home a doctor? Like, but I don't exactly like. There's such an esteem associated with that. Like, oh, I got me a doctor. Versus, I don't know if it works vice versa. Like, I don't know if men are saying that about female physicians. If anything, I think it's more burdensome to them because now it's someone that is taking up a lot of time outside of like their relationship to be in this profession. So, or, you know, there's a situation where like, oh, this female physician is actually making more money than me. So there's so many components to it. Ooh. There's so many components to it. Not to say that.
Don't let me deliver babies and bigger checks than you. Like you're out of there.
Period.
You're out of there.
Period. And not to say that me personally, like, I don't care. I honestly
You're
just
out
need
of there.
someone that, no. I just need someone that's supportive, that's going to love me and raise my kids with me.
Yeah.
I don't need someone that's going to be making $500,000 a year. And, you know, I don't need like the financial support. I really just need the mental support, the spiritual support to be navigating the things that I'm navigating as a physician. But it's not to say that female doctors aren't marrying male doctors or marrying male nurses or marrying people in the medical field. I just think female physicians have a little bit of an uphill battle in terms of having those romantic relationships within their spaces.
Do you find your intimate life, or you ever needing to make like sacrifices of your intimate life based off of your job? Because when I be over your house, you be like, I have a 24-hour shift tomorrow. I'm like, pause. You have a 24 fucking hour.
What?
I'm like, you taking naps at your job? That is crazy.
Yeah,
that is really crazy.
Girl. Yeah.
Do you find yourself like ever making like
sacrifices? Yeah, you have to. My job is my priority right now anyway. And I don't think it's preventing me from like going out on dates and like being able to have romantic relationships with people. But I will say, you know, my time is so precious. So when I do choose to be, you know, like after that 12-hour shift and like go out and date that night.
That's a lucky nigga.
That says a lot.
That's a lucky bastard.
That says a lot. And it's really important that the guy that I'm on the date with kind of recognizes that. Because I have been in relationships where they don't understand the magnitude of like the amount of time and energy that I'm putting into my job. It's not just like I'm working a 9 to 5 and I'm coming home and saying what's up. Not to say that women or anyone that works a 9 to 5 is like they're doing their due diligence, they're working hard themselves. But like I said, from what I see, like those life or death situations can be very traumatizing.
Yeah.
So when I come home or when I like choose to like maybe go out on a date after that, just know that
it's very special.
It's very special.
Don't waste my fucking time.
Don't waste my time, por favor.
And like be on your parts and course.
Right.
This woman is delivering black babies. You should owe her a lot.
I appreciate that.
Yes, but I really feel that.
I appreciate
the world really needs you. Will you be my doctor?
Of course I will.
So like, are you gonna like take my temperature and things like that?
I won't be the one to do that. The nurse will do that, but I will assess.
I don't want a nurse. I want a doctor, Brittany. Okay, all right. I'll still take it too. Okay, but I mean like, how do I do that? Do I like, I don't actually, I promise to God, I don't know how to get a doctor. What's like some advice that you can give us as black folks of like how we can go around like good medical advice? Like if we've been out of the parental medical loop or out of like the healthcare loop for a minute, like how do we go about getting a doctor? How do we go about?
It's a good question.
Yeah.
So I think part of it is actually talking to your girls, talking to your male friends, understanding who are they seeing, if they are seeing anyone. Because 9 times out of 10, if they have providers that they recommend, that is someone that you should probably see.
Cool.
Because there's going to be certain cultural things that even if the doctor is white, they will probably be a better doctor to you because they know they've treated your friend, they've treated your sister, they've treated your brother, they've treated your mom, they've treated your dad.
They're familiar with their community.
They're familiar. So not to say that you have to like go to a black female physician, but you need to go to a physician that is aware of your cultural complexities.
Yes.
So that's number one. So ask around, being able to have conversations with your loved ones to see who they see. And then if, I don't know, for some reason that no one in your life sees a doctor, which could very well happen.
We're kind of there.
Then I would look into the medical systems that are around your area. So doing research. So like getting online, understanding which hospitals are closest to you, seeing if within those hospitals they have not just like black OBGYNs or anything like that, but just seeing if they have a diverse amount of people within the medical system. So that could be nurses, doctors, PAs, because that's also going to play a role in the level of cultural competency that the providers have, usually.
Okay.
So doing your research, talking to people, doing your research, and then typically the way you can get an appointment is just by calling the clinic, or if you have a medical system device, like messaging system device, you can do it like on your phone by downloading the whatever app that's associated with that hospital system. I never even thought about that. Okay. Because that is a good way of like if there's like a app that is affiliated with that particular hospital, you can book appointments that way too. Perfect. But yeah, I feel like those are probably the best ways to kind of navigate getting an appointment and getting in touch with the doctor.
Well, that's really, really good advice. I appreciate you for setting it up, setting it clear, and keeping it real. You've kept it real this whole episode. Of course. It's been wonderful. In closing, I would love to ask you, Dr. Britt, what is a hoodwife to you?
A hoodwife?
Yeah, I really want to hear your answer. Because I tease.
Wow, what a question. I will say I've never gotten this question before in my life.
I'm almost positive.
As you can imagine. 100%.
I'm almost positive for a few reasons.
A hoodwife. Is there a proper definition or is
it's yours.
Subjective? Okay.
It's subjective. Okay. It's subjective.
A hoodwife to me, I feel like is an independent woman. Okay. A woman who takes ownership over the house, over their life. Yes. And they do it unapologetically.
Yeah.
That's a Hoodwife.
Yeah. I had Brittany's nervous. I've never been asked that question.
Hope that works.
That was a beautiful answer. I think you
you.
touched on so much. Dr. Britt, can you tell us where we can find you, how we can support you, anything that you would like to know, or how we can, lend a community hand to you?
Yeah, for sure. Definitely, you guys can look through the hospital systems to check me out. I won't say the exact hospital, but you can always contact E'mon or I offline.
Yes.
And we can talk about getting you set up either within my hospital association or another hospital in the Chicagoland area. And I would say, honestly, if it's not being getting hooked up with me or one of my colleagues, but asking around, most important thing, to be able to find the care that you need and the provider that you need.
Yes. Dr. Britt, ladies and gentlemen. Let's give it up for Dr. Britt. Hold on, let me get this. Love it. Awesome. Well, everybody, this has been an episode of The Real Hoodwives Chicago, a real show with hot sauce stories. Thank you so much, Dr. Britt, for being here. This was a really good and stimulating conversation. I really needed it. Thank you so much again to The Breathing Room, for the Let Us Breathe Collective for the Breathing Room.
Yes, thank you.
This production was also brought to you by BlkHoneyBun Productions and associated with Rise Above and Prosper. Thank you, Carlo.
Thank you,
and yes, my name is E'mon Lauren. I've been your host, and this is A Real Hoodwives Chicago, a real show with hot sauce stories. Yeah.
Can you fuck me like you really want to? Can you love me like you do your hustle? Can you feed me past the food and grubbing? Can you clean me like it's church on Sunday?
Girl, you
in the
have some good
tub,
questions.
scrub a dub.
No, you really